Sure, here are some identifying symptoms of common lung diseases. Coughing. Persistent or chronic coughing that lasts for several weeks or months. It may produce mucus or phlegm in varying amounts. Shortness of breath. Difficulty breathing or a sensation of breathlessness, especially during physical activities or exertion. Wheezing. A high-pitched whistling sound when breathing out, often indicating narrowed airways. Chest pain. Sharp or dull pain in the chest, which may worsen with deep breathing, coughing, or physical activity. Fatigue. Unexplained tiredness or lack of energy, which may be associated with decreased lung function. Recurrent respiratory infections. Frequent or recurring infections such as bronchitis or pneumonia. Cyanosis. Bluish discoloration of the lips, fingers, or nails due to insufficient oxygen in the blood. Coughing up blood. Hemoptysis, or coughing up blood or bloody mucus, may be a symptom of various lung conditions. Frequent or chronic respiratory symptoms. Persistent symptoms such as coughing, wheezing, or shortness of breath that don't go away or keep recurring. Chest tightness. A sensation of pressure, constriction, or discomfort in the chest. It's important to note that these symptoms can be associated with various lung diseases, and the presence of one or more symptoms doesn't necessarily mean a specific diagnosis. If you're experiencing any of these symptoms, it's recommended to consult a healthcare professional for a proper evaluation and diagnosis. Decreased exercise tolerance. Difficulty in performing physical activities that were previously manageable, leading to a reduced ability to exercise or engage in strenuous activities. Rapid or shallow breathing. Breathing faster than normal or taking rapid, shallow breaths, which can be a sign of respiratory distress. Frequent or persistent cough at night. Coughing that interrupts sleep or occurs predominantly during the night, which can be a symptom of certain lung conditions. Unexplained weight loss. Losing weight without trying, which can occur in some advanced stages of lung diseases. Clubbing of the fingers. Enlargement or rounding of the fingertips, often associated with chronic lung conditions. Chest tightness or discomfort. A feeling of pressure or discomfort in the chest, which may be worsened by deep breathing or coughing. Respiratory congestion. Feeling of congestion or a sensation of heaviness in the chest due to mucus buildup. Frequent respiratory allergies or asthma. Regular episodes of allergies or asthma symptoms, such as wheezing, coughing, or shortness of breath, triggered by specific allergens or irritants. Breathlessness or coughing in the presence of irritants. Sensitivity to environmental factors like dust, smoke, chemicals, or strong odors, resulting in breathing difficulties or coughing. Gradual or sudden decline in overall lung function. Decreased lung capacity or a decline in respiratory function over time, as measured through lung function tests. Remember, these symptoms can be indicative of various lung diseases, and it's important to consult a healthcare professional for a proper diagnosis and appropriate medical advice.